Welcome to The Dot, the podcast that aims to bring you closer to the heart of healthcare. I'm your host, Josh Messersmith, and in this episode, we'll be diving deep into the world of Wyandotte Memorial Hospital. Join us as we connect with our dedicated medical providers who work day in and day out to ensure our community's well-being. From doctors and nurses to specialists and therapists, we'll bring you the insightful conversations that shed light on the outstanding care available at our local hospital. Today, I am thrilled to welcome an exceptional guest from Wyandotte Memorial, Dr. Toral Vaidya, a medical, cosmetic, and surgical dermatologist. Dr. Vaidya is an expert in the latest advancements of cosmetic procedures, including injectables, laser services, and hair loss treatments. Dr. Vaidya also offers advanced solutions for skin biopsies, skin cancer screenings, removal of benign lesions, and other complex skin issues. Together, we'll unravel the complexities of modern medicine, demystify procedures and treatments, and educate ourselves on the latest medical advancements. Whether it's discussing cutting-edge technologies or the importance of preventative care, The Dot is here to empower you with the knowledge that can make a real difference in your life. So grab a cup of coffee, sit back, and tune in as we embark on this journey to explore the world of Wyandotte Memorial Hospital.
Welcome to the show now. We're diving deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge, set your mind on fire. Tune into The Dot. Health from head to toe. Together we'll unlock the secrets you should know.
All right. Thank you, Dr. Toral Vaidya, for coming on the podcast, being a part of this. We're excited to hear more about kind of your journey of becoming a dermatologist, but also how you've gotten into cosmetics and then why Wyandotte?
Yeah.
Because you are in New York now.
Yes, correct.
But what led you here? Why you keep coming back? So first, what made you want to pursue a career in dermatology? And why are you passionate about it? And then why Wyandotte?
Yeah, sure. So, my journey to dermatology was clinical and research oriented. And so for me, I had an interest in dermatology really early, even my pre-med days when I was at U Cincinnati. And so my first job related to dermatology was in a research lab, and it was really studying melanoma. I got really interested in dermatology from that scientific, basic science perspective. And then as I kind of grew throughout college and in medical school as well, I got a lot more clinical exposure. And so for me, really, I think that really set in for me that this was a right field for me. I loved that it was a visual field first off. I feel like, I can see what's going on. My patients can also see what's going on with their skin, and we can make decisions together. So I feel like that's really meaningful and impactful. I also really love the procedural aspect of it that we'll touch on in a little bit, but I do surgical dermatology, cosmetic dermatology as well, on top of medical dermatology, which is, treating acne or rosacea, doing skin cancer screenings, which are really important, especially to this area here. And so for me, I just love the breadth of the field and I could do so much. And I also felt that it was sort of a journey and a process that my patient and I could go through together. And so during medical school, I pursued a year of clinical research at Memorial Sloan Kettering, where I did more cancer studies. And I feel like that also really made it important for me to make it a focus of my work that I want to be able to provide really comprehensive skin cancer screenings for my patients, be able to manage them, and also, just know who's in my network to be able to provide the best care. And so for me, all those experiences together led me to choose dermatology and fortunately be able to train in dermatology. And so I did all my training in New York at Memorial Sloan Kettering as well as Weill Cornell Medical Center. And so I am in New York and I practice there part time, but I also recently joined on over here at Wyandotte over the past 6, 7 months or so, I think it's been. And I also practice a full range of dermatology from medical, cosmetic to surgical dermatology. And I guess I could even go into your next question that, why Wyandotte? And so a little bit about me is that I am born and raised in Ohio. I'm from Mansfield, Ohio, went to St. Peter's High School, and I was born at Med Central, Mansfield General Hospital back then. So really like full circle, I've been, this is me. I'm a Midwest girl. And so for me, I really made it a point to want to give back to where I'm from originally. Also, I've really felt that there was a huge need for a provider to focus on skin cancers here as well. especially with just the level of outdoor exposures that we have, and that there's a true lack of providers in terms of dermatologists in the area as well. So I was really excited that there was an opportunity to start and grow the dermatology program here, and it's been an extremely wonderful and rewarding experience to be able to take care of patients.
Now you also have a little bit of a family tie
Yes.
to Wyandotte Memorial also. So
Yes.
tell us a little bit about that.
Yes, absolutely. So, my dad joined on at Wyandotte. I think it's been over maybe 10 years or maybe over that, but he practices sleep and pulmonary medicine. And he always was like lit up when he was talking about Wyandotte. He loves the hospital, loves patients. And then recently, my mother in the last year also joined on doing primarily wound care and infectious diseases. And my parents both loved being here. And when we realized there was a need within dermatology and I had the opportunity to start the program, for me, it was the easiest decision I've ever made to be able to join on. And I'm very grateful for the opportunity to be here. So my parents are both here. If you know Dr. Majbadar, she's actually my aunt in allergies.
Yeah.
So we have a lot of family ties, not only to the Midwest and Ohio and the area, but also directly with Wyandotte Memorial as well.
And I know that the feedback that we hear about you, your parents, your aunt is all great, and it's positive feedback, and everyone really loves the services that we're able to offer them. So thank you to you and to everybody for bringing that here.
Oh no, we're so grateful to be a part of the community. So
So one of the things that I think when people are signing up or providers are signing up and willing to come onto the podcast, what they really don't know that they're signing up for is this is just a free consultation for myself. So what you're getting into is we're going to go through all of my problems. I'm going to expect everything to be for you to cure me in this next hour
yes.
that we're together. But no, I think what I would like to get into now is skincare, skin health, kind of the everyday routine. So, what are some fundamentals for somebody who's just getting started? Or, we talked a little bit earlier about TikTok is telling me, I got to get back into a skincare routine.
Yes.
What are some basic things that people can do to get started on skin health and kind of those different products and a good skincare routine to get into?
Yeah, sure. So, I think that there's this misconception that skincare has to be expensive and complicated, but actually, skincare can be very basic and actually quite affordable. I use so many of my products are from the drugstore. So, really, you can get most products that you really want locally and very easily to protect your skin, prevent aging, and prevent skin cancer as well. So, for me, I think of three essentials for if you are just starting out with trying to build a skincare routine that's effective. The first step is cleanser. So I feel like many of us overlook this step, but finding a cleanser that really is suitable for your skin type is really important for someone who has drier skin, like a creamier cleanser. For someone who has oilier skin, then like a gel-based cleanser. So in general, really finding a cleanser that leaves your skin feeling clean and balanced is the first step. Whether you cleanse once a day or twice a day is dependent on your specific skin concerns or targeted skin problems. But overall, I do think that cleansing with a gentle cleanser 1 to 2 times a day is a step that shouldn't be missed for most people. The second step I would say is sun protection. So I feel like, especially for this area, I feel like this is something that's so important. I feel I've had even just today many patients who told me, growing up I had no idea that the sun was bad. I would tan, I would go outside, use tanning oil. I would have blistering sunburns, and I feel like I'm seeing now more skin cancer in myself, but also in my friends and my family. And that's the truth is that skin cancers that develop, they don't develop overnight. They develop after years of sun exposure, which causes damage to our skin cells. And so, sun exposure that you're getting when you're 10, in your 20s, and your 30s, you might not see the impact right away. But in your 50s, 60s onwards, you might start seeing skin cancers or signs of precancers. And I've actually diagnosed skin cancers in people in their 20s. So, something from tanning bed exposure when they were maybe younger. So, I see skin cancer mostly in patients who are 50 and above, but I'm starting to see it in younger patients as well. So I think that sun protection piece is so important. In terms of the type of sunscreen to use, I usually recommend a broad spectrum sunscreen that's SPF 30 or above. And the reason all of those aspects are important is because broad spectrum protects against UVA and UVB rays. And these are the type of sun rays that can cause skin aging, sunburns, and skin cancer. And SPF 30 is kind of the rating that you should have a goal for. Going above 30 is great as well, but it's not necessary. But at least if you find an SPF 30 or above that you love, wear it every day. Um, and reapply as well. So that's often a misstep, but reapply every 2 hours if you can, especially if you're outside sweating because sunscreen will, it's not going to protect your skin for more than 2 hours normally. So you have to reapply. And I also, the third step I would say is that using, moisturizer for most people, they need something just simple, something that's going to hydrate their skin, keep it feeling balanced but not leaving it greasy. So I feel that the three things that I think about are cleanser, a sunscreen, and a moisturizer. And I think that's even the perfect routine for someone who's maybe even just like 10 or 11 and just start getting excited about these things. So this can be for anybody of all ages, but especially if you have a son or daughter who wants to get a little bit more excited about their skincare routine, but we want them to use products that are safe for them. Those three basics are what I would go for: a cleanser, sunscreen, and a moisturizer. And even if you're someone who's older than that but still trying to get into it, this is perfect for all ages. And then we can also talk about things that are a little bit more targeted or active ingredients to use as well.
So you talked a little bit about it, but can you give us some more information on the how does diet and lifestyle
Hmm.
impact your skin health? I know that anytime the sun comes out, I'm like, I got to get that good base burn
Yeah.
first,
Yep.
and then I'll be good for the rest of the summer.
Yeah.
So what you're saying is that's probably not um, a great process to
Yeah.
have.
Yeah. I mean, I think that's another misconception, is that having a base tan is going to be better for you long term. But any amount of extreme sun exposure, especially when the UV index is high between 10 a.m. to 4 p.m. or so, that is creating those DNA damages to your skin cells, from the get go. Lifestyle wise, I do think that, just seeking shade when you can. I think that being outside is medicine in itself, but I also try to seek shade, especially when it's very direct sunlight. And so, even if you're going to be outdoors, whether it's mowing the lawn or at your daughter's soccer game, whatever it might be, just try to do it during hours that are not peak UV light. So try and usually 10 to 2 p.m., 10 to 3 p.m. is where we have the highest UV exposure in terms of how strong the sun is. But if you're sun protecting, it's still safe to be outside. I think, you brought up diet, which I think is really interesting. I feel like this is something that now I think health in general, we're not just thinking about it, that we're all these sort of organ systems are independent. We know everything kind of works together. I would say the skin is interesting because often the skin is where you can see first signs of underlying things. So for example, if you're someone who has gut issues, a lot of studies recently have shown that the gut and the skin are actually very closely connected. Specifically, having an altered gut microbiome could make you more prone to having inflammatory skin conditions like eczema or something like that. So we are finding more and more that focusing on the gut microbiome may be really important for controlling inflammation in your body, but also in your skin as well. And so what does that mean? So, I think eating a balanced diet, being able to get natural sources of fiber, also being able to have a diet rich in antioxidants, and also just, whether you have a probiotic in the form of a yogurt, for example, or you supplement it, all these things, just having a balanced gut, I think has a lot of impact. And studies have showing more that it actually is important for the skin as well.
I think one misconception is that we only need to worry about sun exposure in the summer.
Hmm.
So how does the seasonal changes affect skin too?
Yeah. So, I think that for the UV index is strongest in the summer for sure. But the truth is that even on a cloudy day, like up to 80% of UV rays can penetrate through clouds. And so I feel like, especially even if you say, oh, I'm not outside all the time, but you might be in your car driving, there is still UV going through your windows. So even if you're indoors, but you're getting UV exposure through a window, that's enough of a reason to at least protect your skin in some capacity. Maybe you sit further away from the window. Maybe you wear sunscreen if you know you're going to be driving in a car for a while. So these are kind of measures that they sort of think about what is your active sun exposure that day. and how can you protect your skin. In terms of all the other seasons, just because the weather is colder doesn't mean that the UV rays aren't out there. So I usually say make sunscreen part of your skincare routine and just use it every day so you don't have to think about it too much. But even if you're someone who doesn't love sunscreen and you don't, I think that it's still the best thing you can do for your skin, but just simply wearing a hat or a visor, even something like that is going to be protecting your skin, even if you're someone who is not wearing sunscreen routinely. So there are measures you can take to protect your skin, even if it's not sunscreen alone.
You kind of talked a little bit about it earlier, but what advice would you give to teens or adults that are trying to manage acne?
Mhm. So, I think acne is really difficult. I definitely had acne as a teenager. I remember how stressed out I used to get about my acne, try to figure out ways to cover it up, and it would only get worse. And so I think the one thing is just normalizing acne. Acne is very normal. We all of us probably had it to some degree. Some people have it milder, some people have it more severe. But I think the one positive thing I am seeing on social media is that I think more people are being more open about their acne journey. So I think that's really encouraging for people of all ages. I would have loved to see that growing up personally, that, it's normal to have acne. A lot of people have it. Um, the second thing is, I think that seeking professional help early is really important. And anybody is welcome to my clinic to see me, but I feel like when I'm able to see my patients with acne early on, when it's milder, we're able to tackle it much more effectively. Because when you wait and the acne becomes more severe, or the cream or the lotion or the wash you're using over the counter isn't working, when acne becomes more severe, it's a lot harder to control, but also it can lead to acne scarring. So I do feel like getting in with a derm provider like myself early is really helpful in terms of just making sure you're not leading to scarring down the road. And acne, there are a range of treatments for acne, from creams to oral medicine. So really, there's every single patient. I have a very detailed discussion with them, and we make a plan together. For me, acne isn't cookie cutter. I really look at the patients individually, but I do think that. Um, the biggest two takeaways I would say is, number one, normalize acne. We know that it all happens as we grow older, through those years in our teens and our youth. And second thing is, seek professional help early, because the last thing you want to do is let it get too severe, and then you need a lot more medication to control it.
I think that the one thing that we found common across every medical professional that we've interviewed on the podcast so far has been that um, the approach to their specialty or their avenue is really determining what the patient needs.
Yeah.
It's not one box fits all.
Yeah, absolutely.
Our one of the podcasts we filmed earlier was about anxiety and depression, and while there is a list of kind of qualifiers,
Mhm.
for lack of a better word, to know if you do have general anxiety. There are things that aren't on that list that probably also still qualify as general anxiety. And so, knowing that there is a patient tailored approach to even the dermatology kind of patterns that we're looking at too is
Mhm.
really nice. I think for our patients to know that my journey isn't the same as yours or the same as somebody else's.
Yeah, absolutely. I mean, I feel like just with anything in medicine, you have to look at the full picture and look at the patient really carefully. So for me, I think about what type of acne my patient has, what even is reasonable or feasible based on their schedule, and what will actually be helpful for them in terms of what they'll use and be able to sort of use consistently. So I really take into account a lot of factors when I'm sort of designing a routine for a patient with acne.
We've talked a lot about I need to integrate sunscreen into my everyday.
Yes.
So sunscreen obviously is important, but what are other ways that younger people can take? What are some of the steps that they can take to maintain healthy skin as they age?
So, for me, I think that using a retinoid, like a retinol, for example, is something that is available over the counter and can make a really big difference over time in terms of skin aging. The way that retinol works basically is that it is a vitamin A derivative, and when applied on the skin, basically it works by boosting collagen in the skin. And so, collagen is that main. It's basically what gives our skin its structure and helps our skin remain firm and nice and elastic. But over time, in our mid 20s, early 30s, collagen is breaking down. Some studies even show that we lose 1% of collagen in our skin every year starting in our late 20s or 30s. So that was like an interesting stat when I heard. And so that's why even, as early as your 20s, using a retinol is something that's really reasonable, just knowing that. And so Retinols are available in the form of creams and serums, and you can get them over the counter. And that's something that I usually recommend using at night if your skin allows it, just to sort of just to sort of kickstart that anti-aging routine. And there are different types of retinoids on the market. Some are stronger, some are gentler. So it really depends on your personal skin type for what you might be able to tolerate. And another ingredient that I find that's pretty helpful is an antioxidant serum, like a vitamin C, for example. And the reason I think vitamin C is a nice ingredient is because it has sort of these properties to protect our skin against stressors in the environment. And so I do think that when you are protecting your skin, it's just creating another layer of defense against what could break down our collagen. And also, vitamin C has some benefit in terms of evening out skin pigmentation, also boosting a little bit of collagen as well. So these are all kind of additions if you already have a strong basic foundation like a cleanser, sunscreen, and moisturizer. But I do think that adding a couple of these things, if you're going to add, I like to keep my routines 3 to 4 ingredients or less. I do think that if you're hitting the right actives and using them consistently, you don't need that many products to have an effective routine.
So how do you integrate Botox, the PRP? How does kind of those cosmetic opportunities, how does that integrate into also the preparation for aging?
Yeah.
I know that when I first started getting Botox, I was saying, "Oh, it's so I can maintain what I have," all this stuff when I'm really like I just don't want my forehead to move. So how can or does it at all? Does Botox help um kind of maintain the youthful look?
Yeah, so the way that Botox works is that it's an injectable medication. It's a neurotoxin specifically, and it works by relaxing our facial muscles. And so when it's very precisely injected into into our muscles of our face, the muscles relax and it prevents the overlying skin from wrinkling. And so Botox is definitely one of those cosmetic procedures that's not a one size fits all. Really, what Botox is targeting is those wrinkles that happen with expression. So think about forehead lines when you raise your eyebrows. Think about 11 lines between your eyebrows when you like scrunch your face. Think about maybe when you smile, you have crow's feet along your eyes. So these are kind of lines that happen when you are expressing, and over time, these lines can get a little bit more etched in. So as soon as I start seeing signs of fine lines getting a little bit more etched in, I feel like that's a perfect time to start Botox. For some people, it might be in their mid 20s. For some people, it might not even be till they're in their 40s. It really is dependent on their anatomy, their genetics to a certain degree, and also personal preference. Some people like to keep some expression lines.
Mhm.
Some people aren't bothered by them at all, and they just want to use creams and serums, which is fine too. But I think Botox it can work really, really well with a strong skincare routine because your skin is working, your skincare routine is targeting kind of your actual skin qualities specifically. It's working on improving your skin quality, whereas Botox is working by preventing deeper lines in the skin by targeting the muscle, actually. So they mechanism wise, they work a little bit differently, but they both kind of have the same goal in terms of improving wrinkles over time, whether that be a retinol or using Botox. But Botox specifically is going to help more with those deeper etched lines that happen over time when you express. So I think that taking a really close look at your expression lines, coming over to our med spa, we have excellent providers who really do detailed exams, really talk about your unique concerns, and we'll kind of dose your Botox based on what's right for you, or maybe they'll tell you Botox isn't right for you. I think it's really person dependent, but I think it's worth getting a consultation if you find that you notice deeper etched lines in your forehead or between your brows, for example, that you want addressed.
So if a patient comes in and is interested in is coming to you for a dermatology appointment,
Mhm.
and they need Botox or that becomes part of their treatment
Uh-huh.
plan. Are you able then to see them in the med spa to be able to work through that?
Yes, absolutely. So, I'm in my medical dermatology clinic when I'm here, usually a couple days a month, and then I also have reserved time where I'm practicing cosmetic dermatology only over at the med spa. So I feel like it really works well together that I'm able to see the patient from a medical perspective, but also be able to talk about their cosmetic concerns as well and be able to treat them myself. So myself as along with other providers in the med spa are able to perform, whether it be injectables or a laser, whatever it might be. So I personally am able to provide that cosmetic dermatology care as well over at the med spa. I'm right around the corner from the derm clinic.
It's super convenient. Same building, right
Absolutely.
down the hall.
Hmm.
It's pretty,
Yes.
and I think I enjoy going to the med spa because it is just the feeling that you get when you leave after you've gotten some type of a service done there. It's just you feel there and you completely feel. I feel like my self confidence is better.
Yeah.
My I'm instantly ready for the Botox to be working now,
Yeah.
even though it takes a few
Yeah.
weeks to set in. I'm
Well,
ready to.
it makes you feel like you're taking an active role in maintaining your skin,
Yeah.
right? So I feel like that should feel good. And I agree completely. Even the med spa, the way it's designed was really beautifully designed. It doesn't make you feel like you're in like a clinic setting. You really feel like you're going there for an enjoyable experience and kind of almost a stress relief and a calming
Yes.
experience too. So I feel like the staff has been wonderful. I really enjoy working there as well. And so I find that, the patients who come through are really pleased with their experience.
So when you look at it, I think everybody always has the preconceived idea that if you get Botox, you have no emotion in your face, nothing moves. And now that's definitely one version of it,
Mhm.
correct?
Yeah.
So if you get a little too much,
Yeah.
but so what is kind of your approach on it? So do you like to stick to more of a natural look and still have some movement, or what is kind of your approach when looking at somebody?
Yeah, I feel like I have a range of patients who say, you know what, I really don't want to express too much. And I have some patients say, I still want to be able to express, but I want to soften some lines. And so Botox is a dose dependent medication. So higher doses, quote unquote, like will freeze the face, whereas lower doses that are so appropriate for your facial muscles maybe will relax your skin a little bit more, prevent those deeper wrinkles, but you'll still be able to express and really feel like you're still able to emote like you want to. So I feel like for me, my personal approach for my patients and myself personally is still having a very natural result. You should look a little bit more refreshed and youthful, but you shouldn't look drastically different after getting Botox, in my opinion. You should look better rested. You should look brighter. You should look younger, but you shouldn't look so drastically different that people feel like, you're not expressing like you used to. So for me, that's kind of my approach to Botox.
Using Botox, but also those other injectables. So dermal fillers, you talked about fillers, but also lasers. So how do you integrate filler and laser into also the cosmetic dermatology approach?
Yeah, so I think for fillers, I tend to like using hyaluronic acid based fillers, and the way that they work, it's like a gel like substance that fills in a space or adds contour to your face. So, for example, a very common area that people ask me about is the deeper lines along their nose. It's called the nasolabial folds. So lines right along your nose, leading to the corners of your lips. So those lines tend to get deeper over time because that's an area where we lose volume over time. And so that is an area that is more amenable to getting a procedure like filler because you're kind of trying to reinforce that area, soften those lines a bit, and give a little bit more support to your lower face. So, for example, filler I think is great for replacing volume that is naturally lost over time. But also, if you want a little bit more contoured of a look, whether that be your jawline or you want a little bit higher of a or more of an accentuated cheek. Like these are all ways that filler can be used to sort of accentuate the face or fill in some natural deficits. So again, filler too is very, very person dependent in terms of what their goals are and their needs as well. No person is the same, but filler is kind of used for a different purpose. Lasers, I see those as more of a skin forward sort of procedure. We have a range of lasers available at the med spa from IPL, which is great for targeting sort of brown spots and facial redness. We have a hair removal laser as well. Whatever your concern might be individually, there's a range of lasers that are available to target that concern. So, but those are mostly just skin forward treatments versus I feel like injectables, such as filler and Botox, are kind of go deeper than that.
Transitioning a little bit back to medical
Mhm.
dermatology. So, how important is early detection for conditions like skin cancer?
Early detection is the name of the game. When you can detect a skin cancer early, you are able to treat it more effectively in terms of it's less likely to grow rapidly. It's less likely to cause more deficits in terms of, needing a larger surgery. And so skin cancer is more common on the head and the neck. That's the most common area where we see them because that's where we get most sun exposure. And so when you are able to detect something when it's small, you're likely going to require a much smaller procedure for it if it needs to be treated. So, you know, most of my patients who come to me saying that something isn't feeling right or healing right, um, I find that a lot of people have a good sense of what actually is something that's different from normal, like different from a normal mole or a benign lesion. Not always, but I do feel like people have a sense because usually things that are skin cancers are not behaving like the rest. They might be crusted, they might be bleeding, they might be sensitive. There's something different about it. So I do feel like when people come to me earlier with these concerns, it's always better to just get a skin check with a derm, get the okay that it's something benign or we can watch it versus getting a biopsy when it's very small because skin cancers, when they become larger, become much, much more of an involved procedure. Um, Also, we recommend generally getting skin checks once a year for patients. If you have a family history or if you have a history of having another cancer or you're immunosuppressed for some reason, then skin cancer checks might even be recommended more frequently than that. And so overall, I think it's one of the, for me, it's like it's a preventative test, right? It's you get a mammogram, you get a colonoscopy, you get a skin check. All of these things are preventative measures to really to put your best self forward. So,
Should a patient or should I be checking moles and for abnormalities on myself? And how often should I check for that? Because I mean, I'm 31 years old and I don't know if I ever have.
yeah, so I do encourage people to do self checks at home. For anywhere from 1 to 3 months, just doing self checks is really important. So I think of skin cancer in two major categories. There's melanoma and there's non melanoma skin cancer. Non melanoma skin cancers are the most common are squamous cell skin cancer and basal cell skin cancer, and these are the most common skin cancers that we tend to see and diagnose, and I personally as well. But the things to look out for a squamous cell and a basal cell, these tend to be pink, sort of raised lesions. They can either be scaly or they can kind of look like sores that aren't healing well. So a common story I hear from a patient is saying, I thought it was a pimple, but it just didn't heal right, and it's become more of a sore that has just been bleeding and bleeding. Anything that's not healing like you would expect it to, for me, that's always a sign that it should be seen. So non-melanoma skin cancers tend to be pink or red, sort of sores or raised areas or scaly areas that don't seem to be healing right. Melanoma is a more serious type of skin cancer, less common but very serious when it is diagnosed. And the things to look out for a melanoma, there's a really nice mnemonic for it. It's called the ABCDEs of melanoma. And so A stands for asymmetric, B stands for border, so an irregular border. C stands for color, so if something is multiple colors. D stands for diameter, so usually something that's greater than the size of a pencil eraser. And E, which is the most important attribute, in my opinion, is evolving. So if something is changing or growing over time, different from the rest of your moles, then that's enough of a reason to come to a derm as well. So I usually tell people try to do a quick check of your skin, on intervals of 1 to 3 months or so. Check for things that aren't healing right. Check for things that are maybe fitting the criteria for the ABCDEs of melanoma. It's always better to be safe than sorry. And even having a baseline established skin check with the derm at any point, I think is helpful because then when you go back, whether it be 6 months or a year later, we have a baseline to sort of compare your skin. And so I definitely recommend at least knowing the warning signs to look out for, and then you can kind of seek professional help if you are concerned about anything.
So as we kind of get to the end here, is there anything that we didn't cover today that you think is important for people to know about their skin health, and about, good takeaways for if they don't listen to any of the rest of the podcast, if they just listen to the last 5 minutes, what is the most important?
Yeah, I would say that overall, there's no replacement for protecting your skin from the sun. I do think that direct sun exposure is the main factor that leads to accelerated skin aging. And especially the most important is skin cancer. And that's something that I think is really, really important for our community to know as well, because especially with a lot of our patients and community, a lot of our work is outside. And so I think that there is a lot of cumulative sun damage that happens over time. And so if you're someone who has had a lot of sun exposure growing up, you work in a field, or you work in a occupation that requires you to be outside a lot, or you're someone who, just are concerned about a mole and you want a derm to check it. These are all enough reasons to really just make an appointment with me, and I can see you, because it's always better to be safe than sorry. Just get a baseline skin check. We can talk about your skin health and figure out ways to help optimize that. But I think no replacement for protecting your skin from the sun. It's never too late to start protecting your skin from the sun, and then seek, professional help and get a baseline skin check.
So after this, everyone's going to be so excited to learn more about derm.
Yes.
So where can they go to learn? Where can listeners go to learn more about dermatology? And then where can they go to connect with you?
Yeah, sure. So, for dermatology resources in general, I find that the American Academy of Dermatology has the best patient resources. They're all written by derms, fact checked by derms. So, commonly, if you have any condition you really want to learn more about, I recommend going to the American Academy of Dermatology website, and they have specific patient directed resources. So, make sure wherever you're seeking your information, it's vetted by a derm. I myself am a dermatologist who's as active on social media, and I love to educate my community on skincare and cosmetics and kind of things that I'm interested in the beauty space. But for anyone who seeks some medical advice or medical care on social media, I would say be very, very careful on who you're getting your information from, because there's a lot of information out there. Not all of it is factual, and ultimately nothing will replace an in-person visit with the doctor, whether it be me or another provider. So I do feel like there's no replacement for that, but make sure if you are getting informed, make sure your sources are good. So, whether that be through the American Academy of Dermatology, I think that's a wonderful site to start with. Our med spa actually has a lot of nice resources as well, in terms of if you're interested in cosmetic procedures, like whether it be a filler, a laser, Botox, PRP, whatever it might be. And so I think that anything that's on our Wine Dot site as well has also been written by providers, fact checked, and so we just want to make sure we're putting the best information forward for you.
Well, thank you so much for bearing the cold today, and coming and talking with me and doing this. I know it's a different avenue for interaction and with our providers. So I really appreciate everything that you've done, everything you brought today for us to learn. And truly, this will make a difference in our patients and our community's lives. So thank you so much, Dr. Vaidya. We're so thankful to have you here, and I can't wait to have you on again.
Yes, thank you so much for having me.
I hope you enjoyed my conversation with Dr. Toral Vaidya. Her dedication to dermatology and her compassionate approach truly highlight the exceptional care available at Wyandotte Memorial. Remember, skin health is a vital part of overall health, and addressing any concern early on is key to maintaining both your skin's health and your confidence. If you or someone you know has questions or needs support, don't hesitate to reach out to the professionals at Wyandotte Memorial Hospital. Thank you for joining us today. We look forward to bringing you more stories and insights from our incredible team of medical providers in future episodes. Until next time, stay healthy, stay informed, and take care of each other.
Secrets you should know.